Now, for palpation of bony structures, systematic and orderly method is important for evaluation of relevant anatomy. You should position yourself behind seated patient. Place your hands upon deltoid and acromion. This is the first contact with the patient should be gentle, firm to instill a feeling of security. A natural cup position for your hands is most efficient and allows the fingertips to gauge the skin temperature also. Now, here you can easily see which are the structures which we can palpate. Here is the clavicle, the spine of scapula which is on the posterior aspect, the acromion which is on the lateral aspect. This is the acromioclavicular joint. From the highest point of concavity, if you go downwards, then there is a coracoid process, the manubrium sterni, the greater tuberosity, the lesser tuberosity, the bicipital groove with the biceps tendon. These are the structures which we can see on the anterior aspect. Now we will see the different methods of palpation. The coracoid process at the highest, deepest portion of the clavicular concavity lowers the finger distally about 1 inch from anterior edge of the clavicle and press laterally, posteriorly in an oblique line until you feel the coracoid process. The process faces anterolaterally, only its medial surface and tip are palpable. It lies deep under the cover of pectoralis major muscle, but it can be felt if pressed firmly into the deltopectoral triangle. And this is the landmark which is very, very important. This can be called as the lighthouse of the shoulder. Now, the second important structure which you palpate here, that is the acromioclavicle. The first structure was coracoid. Now you are going to palpate the second structure, that is the acromioclavicular articulation. Return to clavicle, continue palpation laterally for 1 inch to the subcutaneous acromioclavicular articulation. Clavicle begins to flatten out in its lateral 1/3. It never fully loses its rounded content and protrudes slightly above the acromion. It protrudes slightly above the acromion. The acromioclavicular joint is thus easier to palpate if you push in medial direction against the thickness at the end of clavicle, which is shown in this figure. When you push against the end of the clavicle in the medial direction, motion of the shoulder girdle causes acromioclavicular joint to move and makes it easier to identify. So ask the patient to flex and extend the shoulder several times. Feel the movement of joint under your fingers. The acromioclavicular joint may be tender to palpation with associated crepitation secondary to OA or dislocation of the lateral end of the clavicle. Once again, we are repeating. See, we are examining the patient, or bony palpation is done from the posterior aspect. The first structures which we are palpating, as we mentioned here, that was the coracoid process. After that, we are palpating the acromioclavicular joint. In both the procedures, the clavicle contour is very, very important, and its relation to both of these structures. Now, the second most important structure, that is acromioclavicular articulation, that we already have been discussed. Now, the third one portion which we want to examine, that is the acromion. The acromion is the most prominent bony structure as far as lateral aspect of shoulder is concerned. It is a rectangular, it is referred as shoulder summit. It is the shoulder summit. Contributes to its general counter and palpate its bony dorsum and anterior portion. So here first we will palpate the anterior aspect of acromion. We have already palpated the acromioclavicular joint. Lateral to that will be the anterior aspect of acromion. The bony dorsum of acromion and lateral aspect also should be palpated in a continuous line. The fourth one is the greater tuberosity of the humerus. From the lateral tip of acromion, palpate laterally to greater tuberosity of humerus, which lies inferior to acromion's lateral edge. The greater tuberosity of humerus lies inferior to acromion's lateral edge. There is a small step off between the lateral acromial border and the greater tuberosity. Greater tuberosity palpation is very, very important. Here you can see that it is easily palpable when you go down. When you go down, as mentioned here, you will be able to palpate after one step the greater tuberosity of humerus. The next palpation will be that of the bicipital groove and the lesser tuberosity. The bicipital groove and the lesser tuberosity. Now, the bicipital groove. The bicipital groove is located anterior and medial to the greater tuberosity and bordered laterally by the greater tuberosity, medially by the lesser tuberosity. So it is between two tuberosities, most easily palpable if arm is externally rotated. External rotation represents a groove in a more exposed position for palpation and reveals a smooth succession of greater tuberosity, bicipital groove and the lesser tuberosity. This here we rotate the arm externally. So from greater tuberosity there will be bicipital groove and then we will go for the lesser tuberosity. So external rotation of the arm, which is mentioned here, that we can easily see. Again, you see in this we are externally rotating the arm. Here is the lesser tuberosity, this is the biceps tendon and this is the greater tuberosity. The palpation of bicipital groove should be done very carefully. Too much pressure may hurt the patient. Rotation of the humerus allows for palpation of walls of the bicipital groove.